Good morning.
Morning. Good morning.
Good morning.
Good.
Good morning.
Good. Let's think of a few more
Good
people.
morning.
Good morning.
Welcome, everyone. I guess we'll get started. We'll kick it off. Today, for our Board of Governors prep, we'll start off with healthcare technology and information management. And then thereafter, we'll go into human resources with Grace. So I think we can get started. It's at the top of the hour. Here is our member advancement committee members. We have a lot of them here with us on the call today. We'll go to the next slide. Our representative from San Diego, Mary, is here with us. Thank you, Mary, for joining us. All right, updates and frequently asked questions. So the Survey Monkey will be released at the end of the series. Please, please, please keep an eye out for that. Complete it. We're always looking to improve. There's always opportunity to fine tune and be better at anything you do. There are 8 continuing education units, self-reported. So you have to go into your My ACHE and report those. Here's my bio. I'll start off with the sessions with you guys today. So I've been in healthcare over 20 years. I've done a lot of data integration type of implementations within the healthcare industry. So it's a pleasure to be with you guys today. We can go to the next slide. So healthcare technology and information management. So here's our learning domains for our learning objectives for this session. So again, we want to dig in deep to the functions of information technology and the business operation side of healthcare. So we'll dig into some regulatory requirements as it relates to that, policies and regulations, clinical applications as well. So we can go to the next slide. So, right, healthcare analytics, looking a little bit into information systems and disaster planning, recovery, backup. So these are our learning objectives. We could go to the next slide. All right, so that brings us to our first question, and hopefully we can get you guys participating as we go through our questions for this particular session. So, first question. A CMS program that requires providers to consult a qualified clinical decision support mechanism for the appropriateness of diagnostic imaging services is called. So I think if we look at the options we have available for us, I think Rick did a phenomenal job in kind of helping us prep for testing. So if we look at the first option A, Health Information Technology for Economic and Clinical Health Act, which was our high-tech act, if we remember the inception of that, this was way back in like 2008, 2010, somewhere around there. At least I was really focused on this back in 2010. And it was focused on promoting the adoption of electronic medical records. That was the primary focus of the High Tech Act. So maybe if process of elimination, that may not be the best answer for this particular question. Protecting access to the Medicare Act of 2014. So if we look at this particular regulation here, this act, this was introduced for appropriate use criteria, which mandates the ordering of professionals must consult qualified clinical decision support mechanisms for imaging. So this may be the answer here, but let's look at the other options that we have. So C, meaningful use was a component to me of high tech, right? So meaningful use was related to the EHR incentive programs. That was actually a component under high tech back some time ago. And then if we talk about the American Recovery and Reinvestment Act of 2009, that provided funding for high tech. but does not technically address the clinical decision support mechanisms. So any thought on the answer here? I'm not sure if there's anything being populated in the chat. Anybody want to take a stab at that for the first one? So I would say probably B seems to be the most appropriate answer here for this particular option. Yes, so B is the answer for that one. So we can go to number 2. All right, so COVID. The COVID-19 pandemic plays a significant played a significant role in the expansion of telehealth with the 1135 waiver. So if we look at the options we have here, so allowing Medicare beneficiaries to receive services in a designated rural area is the first option. So that was kind of pre-pandemic, maybe regulations for rural areas to kind of receive telehealth services because of that designation in rural area and not having, the access to healthcare as you would have in more, um, you know, cities or suburbs, more populated areas. So I'm not sure if that's the right answer there. So allowing Medicare beneficiaries to receive services at clinics, hospitals, and certain types of medical facilities. Not really sure that's the right answer for COVID-19 pandemic expansions under the 1135 waiver. So if we look at the 1135 rate waiver, that authority was to expand telehealth, right? There was already some regulatory requirements in place, for beneficiaries to receive services at clinics and certain types of medical facilities. So that's not, I don't think, the answer for this particular question. Encouraging a non-face-to-face communication through an online portal. Mentions of online portal like messagings or emails were not the focus of the 1135 waiver. And so D, Medicare paying for office, hospital, and other visits through telehealth across the country, including patients' place of residence. And I think this is the best option here, or the most appropriate answer with the options that we've been given. Thank you so much for giving your commentary as well. I have someone that put in the chat D. I would agree. D is probably the best answer here. The COVID pandemic, or through the 1135 waiver authority, significantly expanded healthcare access by allowing Medicare to pay for office, hospital, and other visits via telehealth, regardless of the patient's location, even in their own home. The waiver removed these restrictions, enabling patients to receive care from their home or any locations nationwide and allowing providers to be reimbursed for these visits. So that was the 1135 waiver, and D is the best answer for this scenario. Thank you for participating. So number 3. All right. So why is it important for the IT strategy to align with the organization's goals and objectives? So A, to increase Medicare payments. Well, increasing Medicare payments is a financial result, but it's not the core reason for IT strategy alignment, I would say. To improve access to data for management, providers and consumers. I think, that's more related maybe to organizational structure and governance, maybe B. But let's see. I see a couple of people is saying B is maybe the answer here. So B is, B data B is about data, C and D is more about organizational. So I think B, I would have to agree now that I'm kind of reading through all the answers. B is correct, probably because the access of data is the fundamental goal. So B. All right, there we go. Very good. For the answers in the group. All right, next one. So what competencies do not matter in selecting a CIO? Prior management experience. I'm not sure. Having prior management experience is always nice, but it's not, in line with competencies. Knowledge of healthcare organization and delivery. I mean, having knowledge is nice too, but again, I'm not a competency specifically. Um, what competencies do not matter. So knowledge is important, prior management experience is important, and then personal relationship, well, that may be nice to have, but it's not a competency. So, and D, finance and budgeting. So I would say C is the most appropriate answer here. So when selecting a CIO, important competencies do include prior management experience, knowledge of healthcare organization, delivery, and finance and budgeting skills, as these are essential for effective IT leadership, for strategic planning and organizational success, I would say. Um, a, a personal relationship with a board member is definitely not a competency and should not be considered in the selection process. So C was our correct answer here. So number 5. All right. So when introducing a new information technology system to a healthcare organization, resistance can be effectively addressed by, is it A, eliminating existing social groups that appear within the organization? This is not practical and could damage morale, right? Um, employing a policy of mo of man of man I'm sorry, employing a policy of mandated use throughout the organization. It may force adoption, but sometimes that can increase resentment for that option. Or C, focusing on the system users and being responsive to their needs. That is important to do. Addressing user needs and concerns do create buy-in and a smoother transition, making change management more effective, I would say. RD, rapidly introducing the system changes to allow the staff to see cost savings. D often can lead to confusion and maybe resistance also. So I think a lot of people put in the chat as well. C as probably being that's the right answer. All right. I think everybody's doing such a great job. Thank you guys for participating. All right. So the best way to facilitate information system integration within a healthcare organization is it A, centralize all computer activities? B, use computer equipment from one manufacturer? C, use computer software from only one vendor? Or D, standardize data definition and structures? The best way to facilitate information system integration within your organization, I would say D is it. Um, the best way is to ensure information system integration within your organization is to standardize data definitions and structure. We all need to be on the same page because this approach enables different systems, regardless of manufacturer or software vendor, to communicate, share, and interpret data accurately and consistently. So that's very important. All right. 7. Knowledge management is defined as, all right. So knowledge management is the systematic process of creating, sharing, using, and managing the knowledge and information of an organization. So that's important for us to kind of dig into into that definition. The primary goal is to leverage intellectual assets such as expertise, best practices, and institutionalized knowledge to likely improve efficiency, innovation, and organizational effectiveness. So now that we've kind of talked a little bit about knowledge management in itself. So what's the best answer here? So a practice of explicitly and deliberately building, renewing, and applying relevant intellectual assets to maximize organizational effectiveness. Or B, the transfer of structured information between two computer systems. Or C, a movement to explicitly use the current best available scientific evidence for managerial decision making. Or D, planning, organizing, directing, and controlling of resources to accomplish goals and objectives related to a distinct initiative. So I think a lot of people is mentioning A in the chat here. And I think A is the most comprehensive. I would agree with that. B is simply about maybe data transfer and knowledge management, not as comprehensive as I would say A is. C refers to more evidence-based management or clinical decision making. And D is more general project management type of concepts. So A is probably maybe the best answer here. Yeah. Um, Knowledge management is about maximizing an organization effectiveness by intentionally managing and applying its collective knowledge. So A, good job. Everybody's doing a phenomenal job here and putting the appropriate answers in the chat. So next here, 8. Which of the following is a reason that system support of outcomes, data selections, and analysis can be very complex? So here, let's look at kind of the options we have available for us here. So A, the required data typically resides in multiple information systems and in manual systems as well. And in healthcare, definitely, I would say that's very true. We have multiple information systems doing a multitude of different things within healthcare. And that's definitely what makes it extremely complex. Working with a software technology to try to have more of a comprehensive tool within the middle revenue cycle right now, and it's definitely not easy to do. So the complexities in having multiple information systems and manual systems on top of that does make it complex. Or B, the functional departments are not integrated with financial systems. You know, that that's logical, but definitely in the data collection component and analysis may not be the best answer here. So C, there's inconsistent medical terminology across different clinical systems. That's kind of just honing in on, I think, one specific system within healthcare because there are a multitude across different divisions. Or D, variations exist between open systems architect, interface engines, and multimedia data entry options. So I would say again, we are our best answer is A, the functional departments and the multi-systems in healthcare definitely makes it complex. This is the key reason why collecting and analyzing data can be complex in many healthcare organizations. Data relevant to outcomes like clinical, operational, and financial are scattered across various systems. So again, I think the answer here is A. All right. So good job again, everybody in the chat. Definitely provided the correct answer. So nine, membership of the IT steering committee should be comprised of. So we have A, this is all of our C-suite individuals. While I would say it's important for them to be aware of what's going on within the organization, the steering committee may need a little bit more representation. So I'm not sure about A being the best answer here. B, representatives of administration, physician leadership, information systems, and major user departments. I would say this is probably the most appropriate answer. You definitely need those representatives from administration, your physicians, because everything in healthcare impacts them, especially when we're looking at the middle revenue cycle and that clinical care, information systems, of course, and then any departments that may be impacted by the technology at hand. So B seems to be the most logical answer here. C, the CIO and senior system analysts. Well, I think you need a little bit more representation than just those individuals within the steering committee. D, again, the CIO and outside technical teams. Well, that doesn't provide a lot of value for the people inside the health system. So that's not the best answer. And then E, consultants. So I think we all agree on B for this particular question. Absolutely B. An effective steering committee needs a broad representation from key stakeholders across the organization to assure its alignment with strategy and the organizational goals without question. So we can go to the next slide. The selection of an information system in the healthcare organization should begin with a meeting with several information system vendors to determine the scope of available technology. I mean, I think for that effectiveness, when we're talking about the selection, I think that needs to come from some type of strategy or perhaps plan that the organization may have at the forefront, and then thereafter they can definitely consult with the technology vendors to ensure that it meets their needs and their goals. So A, I would say, is not probably the best answer here. Hiring an information systems consultant to determine the organization's strategic needs. I don't think that's the best answer here. Um, Development of an organization's system plans that supports the organization's existing strategic objectives. I think a lot of people in the chat is picking this particular option. The selection of an information system surely must and should align with the organization's strategic goal. And that has to come from the organization themselves. So D at this point seems to be the most appropriate answer. I'm sorry, C. And then our last option is D, evaluation of available hardware and software to best determine what meets the organization's needs. And so again, I think if we're looking at what the question is asking, so selection of the information system and healthcare organization should begin. How do we begin that selection? And I would say, as many people in the chat has entered, C is probably the best option here for this particular question. All right. So it looks like C is it. Okay, so 11, NIT system development life cycle. So I think for this particular question, we need to know all the components of the system development life cycle from from a definitional viewpoint. So if you're not aware of those, you may want to take a little time to refresh your knowledge of these particular concepts within the IT system development lifecycle, first and foremost, to be able to identify which one is the most important. So if we look at system analysis, so system analysis, if we're looking at that, looking at existing workflows, system, pain points, really looking at the foundation of the system, identifying needs, like I just mentioned, identifying your needs, your workflow systems, and pain points. So the system design component depends really on a good analysis. Your system acquisition can be wasted if the wrong needs were identified. So, it looks like that system analysis is the building component and perhaps the most important because we need to have that analysis before we can identify the rest of the steps within the IT system development lifecycle. The last option here is system implementation. And for implementation, you'll if you don't have all these other components in place, and the requirements understood, then implementation may not be as successful as you would need it to be. So it looks like A, which a lot of people in the chat has entered. A is probably the best answer here. All right. 12, an application that assesses structured databases of clinical information to aid a clinician provider in defining probable diagnoses or selecting appropriate diagnostic tests are treatment options. So for this particular one, okay, so an application that assesses structured databases of clinical information to aid a clinician in defining probable diagnosis. Okay, so I think the key is structured database of clinical information, right? So a data warehouse is probably not um, something that can assist a clinician in leveraging clinical information to aid in defining a probable diagnosis. I don't think the data storage is an appropriate or data warehouse is an appropriate option here, which stores large amounts of data. So clinical decision support systems are definitely reliant on structured clinical data, and it definitely can be used, rule algorithms that can be used, that can be evidence-based center definitions. So right now, B is definitely the seems to be a viable answer here. Or is it C, health informatics? Health informatics itself is just a broad field involving IT. It's not anything specifically to do with a clinical support or clinical decision support methodology. And so a clinical data repository, again, that's more of data storage. So the most appropriate answer here would probably be B. All right. Well, we got through this particular session. Any questions at this time about this particular section? You will get the slides. If there's any concept within the slides you're not very familiar with, I definitely would encourage you to do additional research. You can always ask us additional questions as well as it pertains to anything within the specific domains. We're happy to answer those. Like I said, you will get the recording and the slides from our CAHL membership inbox. Okay. All right, great. Someone said they will be doing a lot of research. Please, 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 as you do your research, if you have any questions, do not hesitate to reply to the email you get and present those questions. We're happy to answer them. So without any further ado, I will hand over the next session of this um, committee or this session to Grace, who will lead us into questions and answers for the human resource component. So, here, Grace.
Yes, here I am. All right, thank you. All right, so I will just kind of jump right into it. So we're going to go over the human resource portion of it. I know with myself, I'm in the compliance world, but definitely touch bases with human resources, or as a lot of organizations are now calling it, the people team. So I have a lot of contact and discussions with them over time. So with human resources is really just going over some of these laws and regulations, recruitment, knowing about knowledge of staff methodologies is important, the performance management system, so performance-based evaluations and rewards, also some of the disciplinary policies and procedures, knowledge of employee motivation, development, and principles, knowledge of employee satisfaction and engagement, and knowledge of compensation and benefits practices. There's also employee safety and security, so where OSHA gets involved, or workplace violence, conflict resolution and grievance, the impacts and consequences of human resource decision making in regards to operations, finance, healthcare, and quality of care, selection techniques, labor relations, job design processes in terms of, looking at the job descriptions and working on those. Um, Also succession planning models. All right, so we'll start with the first question. So which of the following is typically performed during a background check? So definitely looking at either A, the verification of personal finances, B, involvement in religious or political activities, C, previous employment or education claims, D, prior performance evaluations. So just looking at these, I don't believe, we would really look at any personal finances, maybe if they are applying for a CFO position, but I don't think that we would normally be looking at that. Involvement in religious or political activities, again, don't see where that would really come into play much. Think C, looking at previous employment or education claims. And I see a lot of people are choosing C in the chat, which this one really makes sense. A lot of, they will request your previous employment. If you have certain degrees for that position, they may want to see copies of the degrees or even a transcript. And then D, prior performance evaluations. I think these are important, but um, I haven't seen much where they ask for these. I think sometimes I've seen where individuals will bring their performance evaluation, just to kind of see what they've done in the past as part of their resume packet. So I will defer to the group as well as what I feel would be the answer, which is C. So let's see. And it is C. Okay. All right. So for number two, the primary purpose of a well-developed performance appraisal system is to, so look at what the word that sticks out to me is primary. So which one would be the first? So A would be compare employees across the organization. B, provide employees with developmental feedback and guidance, which I think that's very important. I know for myself, I love to get feedback and guidance. C, ensure employees understand the job they are supposed to be doing. I do think that's very important, and that's usually given with a job description and then, some information with uh, your supervisor should be really explaining what your job is. Also, D, last one, determine how well management engages employees. So in looking at what the primary purpose, I would veer more towards B, providing employees with feedback and guidance, and it looks like a lot of folks are choosing B as well. So yep, it is B. Right, number three. So with growing frequency, employees who have been dismissed are resorting to lawsuits for redress. In such cases, the court may find in favor of the plaintiff if the employer dismissed that plaintiff. So it would be either A, for cause, but without using progressive discipline. B, without cause. C, before the end of the plaintiff's probationary period. D, for union organizing activities. So again, it says, in such cases, the court may find in favor. Um, and I would go more for without cause. Uh, I know we've got a couple B's in there and some A's. And yep, it is B. We're at four already. Okay. So which of the following would be considered the most effective approach to preventing the need for employee disciplinary action? So what would be the most effective? Um, I know when I read these questions, I try and pick out the key words. My keyword is effective, most effective. So A, have an accurate job description. Um, B, have an employee orientation program, which I think having an employee orientation program is very important. But so is definitely having that accurate job description. And I think too, with any job description, the employee should be given it. They should sign off on it, so that, they understand that. Um, C, implementing a performance-based compensation system. Um, and then D, giving managers a small span of control. So C and D, I don't really think would be the most effective approach. I think if it was any of the two, it would be either A or B. I'm veering more towards A because I think that's really important, to have an effective job description. But I also do think orientation programs are important as well. Oh, somebody wants. Okay, that's what I was going to say. Okay, so we'll go with I'll go with A. See. Okay. So number five, which activity should precede the beginning of a recruitment process for a new employee? So which would be at the beginning? So A, obtaining information from employees in a similar position to assess the validity of the job description. Um, B, assessing the costs of various forms of recruitment. Uh, I think that's important too. I think HR departments will do that just to see what they need to do for recruitment. C, making a decision whether to emphasize internal or external recruitment. Um, D, conducting a job analysis. So if we're looking at the activity that should precede the beginning of recruitment, um, the one that sticks out to me the most, and it looks like a lot of folks are answering that too, would be D, looking at really the analysis of that job. That way you can make decisions after. So you're looking at that job analysis and saying, okay, now what are we going to do? What are the next steps after? So, conducting a thorough analysis, I believe, would be the most important activity. And it is. Okay. All right. So number six, the evaluation of senior management is best administered with A, when criteria are established and known to both parties. I think that's important. B, on a scheduled periodic basis. So I think it should be more than just on a scheduled periodic basis. C, after consultation with the executive committee of the board. Um, Not that one. D, in conjunction with a salary adjustment. Though I think with most of them, you want to do all of these. I think if we're looking at which one is best, it looks like a lot of folks are answering A, would be the when criteria are established and known to both parties. I think is probably the best administered answer. And we can see if that one is, which it is. Okay. Moving on to number 7. The critical incidence technique of employee performance appraisal requires raters to A, select statements that fit the performance characteristics of individuals. Um, B, select the highest and lowest performing employee in a work unit. Um, C, record the degree to which specified behaviors are performed. And D, record behaviors of employees that are related to both good and poor performance. So this one, being not too familiar much in the HR world, um, it looks like a lot of folks are answering A. Uh, I think select statements that fit the performance character. So I think that is important. I think looking at good, let's see, yeah, record behaviors of employees that are related to both good and poor behavior. Looking at this, possibly A or maybe, I don't think it would be C, record the degree to which specified behaviors are performed. I don't think we would need to record to that degree. I don't think that we would want to select highest and lowest performing employees. So I would rule out B and C, and I would possibly look at either A and D, and we can kind of look, a lot of folks are saying A. Let's see what the answer is. And it is D. Okay. So I would have been looking at either A and D, but it is D. Number 8, according to Herzberg's hygiene and motivators theory of motivation, um, would it be A, cleanliness of the workplace, or workplace plays an important role in motivation? I think that's true. I think, you want to have a cleanliness environment. Um, I'm not sure if that would actually be part of this Herzberg hygiene and motivators theory. Uh, B, the absence of adequate compensation can be a dissatisfier, but the presence of adequate compensation is not a motivator. Okay. I think that one is pretty fair statement. C, employees are motivated by money and factors intrinsic to the job itself. I know, although that can, that's definitely can be true. We all like money, but I think there's more to it than that in most cases with the job and having that overall job satisfaction. And then there's D, extrinsic factors are prime motivators. So I'm going to figure, I don't know if see anybody in the chat making a guess there. Without having the Herzberg hygiene, and I'd have to probably go and, look that up because it's been a while since I've looked up that information. But I would probably stick more towards B. We can see if that is. We do have a couple D's in there, but it is B. Okay. All right. So I think that's all we have for that. See if there's any questions anybody has. I know like we mentioned before, we will be sharing these slides with everybody so that they can have them, and you'll get those at the end of the session or within a day or so. See, what else do we have? Do we have
So we
anything?
have the regular slides. We do have some supplemental. I don't know if we have enough time. We want to go through some of those as well.
Okay. What do you think, committee? I mean, we can definitely do some supplemental. I know we only had the 8 for, I don't know what time we're at or how much more time we have, or if we have any specific questions that we could try and answer as well. Um,
Yeah, if anybody in the meeting wants to come off mute and have they have any questions, feel free to join.
well, do we want to, and I'll let some of our committee members decide, do we want to continue on or do we want to end early since we have completed some of these?
We do have some supplemental questions, don't we?
Believe so.
Yeah, I got a couple
Yeah.
ready.
Um,
Put 'em up.
Maybe before we do that, I just did have one thing I wanted to throw in that I'll forget if I wait till later, which is as you're doing your application to ACHE, one of the things you have to do is have various references, and some of them have to be fellows. Therefore, you may not know people to do that. You may not have people around you in work. Feel free to call on us. I'm going to put my email into the chat, and several of you have already found me on LinkedIn, so feel free to do that as well. But if you need the structured interview or anything, just contact us. We're happy to do it after you've gone through all this stuff.
So let's see. Right, so we'll start with this. I don't know how many questions, supplemental ones we have, but the theory that employees in an organization will be promoted to their highest level of competence and then be promoted to and remain at a level at which they are incompetent would be A, internal recruitment, B, the Peter principle, C, external recruitment, or D, inbreeding recruitments. So this one's interesting. I'm not too familiar. I know looks like there's a B in the chat, which is the Peter principle. And I will admit I would have to go back and look at some of my reading because I'm not familiar with this Peter principle. So I will go ahead and see. And it is B, the Peter principle. All right. See, number 2, a non-binding type of dispute resolution in which a neutral third party attempts to assist in negotiations between the two primary parties. So A, litigation. I would say no with that one. B, arbitration. I'm veering more towards arbitration. Or C, alternative dispute resolution. Or D, mediation. So here, dispute resolution in which a neutral party, third party attempts to assist. I would veer towards probably mediation because you have somebody there, a third party, between the two parties. Let's see if we do got a couple. Yeah, so it is D.
So the key word in this one is the non-binding.
Non-binding, yes, yeah, you're correct. So 3, a ratio that provides a summary of the gross movement in and out of staff in an organization during a specific time frame. So ratio, so would be A, turnover rate, B, retention rate, C, recruitment strategy technique, D, vacancy rate. So looking at this, I would veer more towards possibly the retention rate or turnover rate. So either A and B. I don't believe it would be anything with vacancy rate. And we do got a lot of A's and B's in here. So let's see what the answer. So A, turnover rate. Yeah. Or so a U.S. labor law passed in response to U.S. Supreme Court decisions that limited the rights of employees who had sued their employees for discrimination. So what was this labor law? Would A, Civil Rights Act of 1991, B, the Equal Pay Act of 1963, C, the Uniformed Services Employment and Reemployment Act of 1994, D, illegal discrimination. So I think we want to look at, I would take out D, and I would look at either A, B, and C. We have a lot of A's in there, a couple B's. So I would veer towards A. We can see. And it is A, the Civil Rights Act. Oh, somebody says there's a typo in the question. I'm not sure. Sure what the typo is. Oh, employers. Thank you. Yes. Yeah, so had sued their employers for discrimination. Yeah, correct. All right, 5. Health professionals such as therapists, medical and radiologic technologists, social workers, health educators, and other ancillary personnel are called A, allied health professionals, B, rehabilitation professionals, C, technical, D, engineer and scientist professionals. So I think we're looking at all those, the therapists, medical, technologists, social workers. It looks like everybody is answering this correct, but put them under allied health because they wouldn't be specific to the other 3. And it is A. Nice. 6. The result of a practice that may appear to be neutral but has a discriminatory effect is called A, confirmative action, B, affirmative action, C, disparate impact, or D, disparate treatment. So I would take out C and D. I'm not familiar too much with confirmative action, so immediately I would look at what affirmative action. Let's see that. That's a lot of folks
So
are
the
either saying
answer,
A or B. Go on, go on.
the answer for this one is actually C.
It is, okay. So
Yeah,
that's
so
good.
disparate impact is the result of a practice that may appear to be neutral but has a discriminatory effect.
Ah, thank you, thank you. See, I would have got that one wrong. Okay. So 7, a federal agency responsible for ending employment discrimination files lawsuits on behalf of alleged victims of discrimination in the workplace. So federal agency. So which one is responsible? So is it A, Equal Opportunity Commission, B, the Reasonable Accommodation, C, Age Discrimination and Employment Act, D, federal employment laws. So we're looking at a federal agency responsible. B, C, and D actually don't, are not necessarily an agency. So I would be looking at the word commission. So A, and it looks like a lot of folks are either saying B or A here. But I would look at A, would be my first guess. And it is A.
I think that's very important just to walk into the question like this, because sometimes even if you don't know the answer, you're able to rule out a lot of the answers that just not fit the question, right?
Mhm. Yeah, correct.
All right, and that's the last of our slide questions.
Okay. Any questions from anybody in the chat? Okay. Right. Well, I guess there's nothing else that our committee members want to announce. So we are done for our session today. So thank you all for attending. And again, you will get those PowerPoints, so you guys can have them for review. If any questions come up, also feel free to email the committee as well. So, all right. Have a great weekend, everybody.